I am Dr. Dipak Suresh Bathe, consultant physician from Durgapur, West Bengal. Today we will talk about hypertension and how to prevent it. So let's first see what is blood pressure. When heart contracts, then it moves blood in blood vessel and creates pressure against the wall of the blood vessels. It is known as blood pressure. And persistent increase of blood pressure above the normal blood pressure is known as hypertension. So optimum or healthy blood pressure should be less than 120 by 80 mm of Hg. Here 120 is systolic blood pressure and 80 is a diastolic blood pressure. So what is systolic blood pressure? The blood pressure in blood vessels when heart contracts, and diastolic blood pressure is a blood pressure in blood vessels when heart rests between the beats. So let's see some classification of blood pressure. So systolic blood pressure of 120 to 129 and diastolic blood pressure from 80 to 84 is a normal blood pressure. And systolic blood pressure of 130 to 139 and diastolic blood pressure of 85 to 89 is a high normal blood pressure. And systolic blood pressure of 140 or above or diastolic blood pressure of 90 or above is a hypertension. So let's take a look on some of the symptoms of the blood pressures. So blood pressure usually doesn't have obvious signs and symptoms, but if symptoms do occur, then it is like morning headache, tiredness, nausea, and vomiting. So only one way to know the person has blood pressure or not is to measure the blood pressure. And now we will see some of the risk factors for the development of hypertension. So most important is age. So as age increases, the blood vessels steepens and it becomes narrow due to fat deposition, and it results in development of hypertension. Second is positive family history. Third is increased salt intake or consumption of processed food or increased fatty food intake. And third is stress. Stress is very important aspects for development of hypertension. And fourth is sedentary lifestyle. It is also very important as for development of hypertension. Now we will see some of the complications of hypertension. So hypertension can cause some of the complications like heart, cardiovascular diseases, kidney failure, and stroke. So management of hypertension is very essential to prevention of these complications. So now we will see some of the preventive measures for the control of hypertension. So most important is regular physical activity or exercise. So regular physical activity can reduce the blood pressure and helps in control of hypertension. Second is having healthy foods. That is the foods which contains whole grains, vegetables, and fruits. And also there is one concept that is DASH diet. We should follow the DASH diet. The full form of DASH is dietary approach to stop hypertension. And there is also important aspect about the sodium. We should reduce the intake of sodium, that is salt, in our diet. And fourth is management of stress. We can manage the stress by following meditation, by listening music, or by doing regular exercise. The fourth, one important aspect to manage the hypertension is to monitor the blood pressure regularly. So regularly monitoring the blood pressure, we know how it changes, blood pressure changes on whole day, and we can adjust the dose according to that pattern. And most important aspect is about adherence of medication. Adherence is taking regularly and on time medication of hypertension. So by following all these measures, we can we can control the hypertension. So by regularly monitoring the blood pressure and having preventive care, we can very well manage the blood pressure and we can prevent the complications caused by hypertension. So here I conclude my talk. Thank you.